my delay. We're going to begin with House Bill 1135, Health Occupations, Pharmacists, Vaccination Orders. Delegate Lopez, do you wish to make a motion?
I move the bill is
Listening.
amended.
We are only going to hear from members at this late hour, only from members of the House and or the full committee. Delegate Lopez, House Bill 1135.
Yeah, I'll move the bill as amended.
Can you just very briefly describe the bill?
Sure. The bill,
Go ahead.
I think she might have frozen.
Are you frozen, Delegate Lopez? Council, can you briefly describe the bill?
The bill authorizes a pharmacist to order a vaccine for an individual who's at least 3 years old without the pharmacist administering the vaccine. If a vaccine is administered to an individual younger than 18 or ordered for administration originally as introduced by an adult caregiver to an individual younger than 18, the pharmacist must inform the patient and adult caregiver of the importance of visits with a pediatric primary care provider and refer the patient to a pediatric primary care provider when appropriate. The amendments adopted in subcommittee alter the reference to administration by an adult caregiver to be by a parent or guardian and limit the bill to just vaccines that are given through intranasal administration.
Okay, Delegate Lopez, you're back with us live and in person?
yes, can you hear me?
Yes.
Okay, yes, I am here on the floor.
Were you fine with that summary from council?
That was beautiful, and I'll move the bill as amended in case that wasn't heard the first time around.
Thank you. All those in favor of the bill as amended, please raise your electronic hand, assuming those work.
I'm sorry, Mr. Speaker. Mr. Chair.
Yes.
Are we moving the amendments first?
This is okay. We should move. This is just on the amendment.
These
Yeah.
amendments were adopted in a previous subcommittee
Last
meeting.
time.
already,
Okay.
So this is
Okay.
as amended.
So this
Okay.
is on the bill as amended. All those in favor? of
Okay,
the
then
bill as amended.
I
I
s-
see.
I have a
4,
question though.
Counting me. Okay, Delegate Riley.
Sorry. Thank you. Thank you, Mr. Chair. So, I like the amendments and it cleared up some of the questions that I had, but I still have one more that I don't think has been answered and maybe, Delegate Lopez could or Lindsay. So, so there was a concern about the vaccine is considered a biohazard, and if there's something left in it, then it could be picked up by, a bystander or what have you. And plus, since it's a biohazard, because it's made from a live virus, is that dangerous to other people that may be around it? I'm sorry, was I frozen?
No, we heard you.
Oh, okay.
Who wishes to speak in response? Council, can you speak to that, or the sponsor? Can you speak to
I
that?
can't speak to that. I don't recall that being raised
Okay.
previously.
Okay, I can speak to it, Mr. Chairman. Pharmacies are equipped to handle waste for medical waste and for excess drugs and that type of thing, so that wouldn't be
Okay.
a concern.
But they're
Okay.
going home.
Thank you.
But
All right. The motion is on the bill as amended.
I'm
all those-
sorry. I'm sorry. He didn't answer my question. These are going home. They're not at the pharmacy.
Well, it would be the same as any medicine that was dispensed going home with someone.
Well, usually it's okay, but usually it's a pill or something like that, which is fine.
Well,
But
you
this
also
is an
have
open virus. No.
it can be made from a live virus, but the virus isn't live when it's administered to the patient.
Okay, thank you.
Okay. The motion and the roll call is on the bill as amended. All those in favor of the bill as amended, please raise your electronic hand. And that includes any member of the full committee includes the vice chair who has voted. Good. Okay. There are 6 in favor. Anyone against? Okay, the bill passes. House Bill 1150, Health Occupations, Pharmacists, Minor Conditions, and HIV Prevention and Treatment. Delegate Kerr. Can you briefly summarize the bill? Delegate Kerr is the sponsor. Unless you want to defer to council.
He's getting back on.
I was going to say he didn't drop off because somebody else's bill passed.
Well,
Council, can you explain the
I was
bill
gonna
or
say,
describe the bill?
yeah, let's start with Lindsay.
So this bill authorizes a pharmacist to order, test for, screen for, and treat certain minor conditions in accordance with a statewide written protocol established by the Board of Pharmacy. The bill repeals the non-occupational post-exposure prophylaxis standing order program and instead authorizes the Department of Health to establish a statewide written protocol for the delivery of pre-exposure and post-exposure prophylaxis medications for the prevention of HIV and treatment of HIV. The sponsor offered amendments to strike language relating to what drugs or devices a pharmacist may prescribe in favor of a specific list of conditions that's listed elsewhere in the bill, strikes specific conditions for which a pharmacist may order, test for, screen for, or treat. And so specifically, they're striking cold sores, lice, and skin conditions, including ringworm, and strikes language authorizing a pharmacist to delegate the administrative and technical tasks of performing a test to a pharmacy student or individual in a pharmacy technician training program, but adds there a registered pharmacy intern. The last time we discussed this bill in subcommittee, I also suggested a technical amendment because the phrasing order, test for, screen for, or treat, I think should be order a test for. Actually test for, screen for, and treat, because order does not really make sense there. It's like kind of cut off. The question that was raised in the subcommittee last time we met was about the inclusion of urinary tract infections on that specific list.
Delegate Kerr is waiting to be let in to the meeting.
Oh, thank you. So we can't let him in at the moment.
Mr. Chair, while we have a moment, can I have a vote change? I'm going to stick with my no vote on the previous bill.
Okay.
Please, on
Council.
1135.
Yeah.
Thank you.
Sam,
Here.
can you let
Oh, you're
Delegate
in
Kerr
now?
in?
All right, he just got it.
There he is.
Okay. My chief of staff has returned. Delegate,
Okay.
is there a specific question for Delegate Kerr?
I
Delegate
think we
Tavares, do
wanted
you have a
him.
question?
Yes.
Go ahead.
So, Delegate Kerr, when you and I spoke outside, in the lobby, you mentioned that in order to have a urinary tract infection medication, you needed to have a urinary sample. And here, there isn't an opportunity to get a sample. So if a child is abused, or sexually molested, how can we really, that's maybe the pharmacy is not the most appropriate place.
Well, what I understand about this bill is this is test and treat. And so there would have to be a testing component before the pharmacist would be able to prescribe a controlled medication. Anything over the counter, sure, they could prescribe it or dispense it. But the way
But
that
it says here, the pharmacist may order, test for, screen for, and treat minor conditions.
But again, the operative word is test for and screen, which would require a test.
Vice
as
Chair of
I'm-
the committee is
Mr.
recognized.
I don't know. That's a very delicate issue because to me, this is more of a GYN issue.
Mr. Chair,
OBGYN.
Delegate Cullison is recognized.
thank you, Mr. Chair. I'm wondering if Aaliyah Horton can shed a little light on this. With respect to, with the bill, is there an expectation that there would be a urinary sample at the pharmacy?
Thank you for the opportunity to speak. We actually were okay with removing UTIs. The Board of Pharmacy was concerned about it. And so it sent a communication to the subcommittee members that we were okay with that, with removing UTIs, if that's going to be a concern.
Mr. Chair, may I move that we consider removing urinary
Second.
tract infection?
Second.
The motion is to remove urinary infections from the scope of the bill. Sponsor,
The sponsor's fine with that amendment.
is there any objection to that amendment? Seeing none, it is adopted. Is there a motion before us on the bill as amended?
Second, move
To
as
clarify,
amended.
with the total amendments, with Delegate Kerr's amendments, with the change to remove UTI in addition.
All the amendments that have been discussed and either accepted or there's no objection to, no objection.
Yes, and the
expressed.
friendly amendment, yes. Move as amended.
Is there a second?
Second.
Okay, all those in favor of the bill as amended, please raise your electronic hand.
Okay. Sorry, Mr. Chair, I have a question before you move the bill as amended.
Go ahead.
Okay, so originally I had the same thing as Delegate Taveras had a no, but there were a couple other things I know. Or with this amendment, could that possibly change the opposition that we may have had from some of the physicians and then MedChi? Because I think their issue was more about there was really no real follow-up to a physician. So this bill still doesn't have a follow-up, right? It's just being tested and screened at the pharmacy and that's it?
And treated as appropriate.
And so you're saying treated means you're telling them that they need to go to a physician, or is that?
It depends on the diagnosis, I believe. And I'm sorry, Mr. Chair.
So they can actually be treated in a pharmacy?
Under this bill, yes.
Okay, all right, thank you.
Okay. Delegate Riley, are you still in favor of the amendments? Your hand is still up. Just want to make sure. Okay, it's unanimous. Is there a motion on the bill as amended?
Move the
Move
bill
the
as amended.
Second.
All right, all those in favor of the bill as amended, please raise your electronic hand. Therefore, Delegate Alston, are you not voting? You are a positive. All those opposed? Delegate Riley, are you opposed? Please put your hand down.
Yes, I
if you
am.
voted yes.
Oh,
Delegate
sorry.
Riley is
Is a
opposed.
no.
So the vote is 5-1.
Thank you.
Certainly, thank you. House Bill 1372, Public Health Office of Healthcare Quality Information and Maryland Department of Health Centralization Commission. Delegate Solomon, please speak briefly to what the bill would do.
Thank you, Mr. Chair. This is the bill that I mentioned as part of the audits package, was supported by the audit committee. The bill does two things.
Okay.
Can you hear me, Mr. Chair?
Yes, I now know what request of JAEC means.
Yes, the
Audit Committee.
Joint Audit and Evaluation Committee.
Thank you.
Yes.
Go ahead.
So the bill requires the Office of Healthcare Quality to post information about inspections and ratings of facilities. That's section 1 of the bill. And then section 2 creates a Health Occupation Board Commission for folks to look at various administrative barriers and potential reforms to Health Occupation Board Commissions. We amended the bill. As you'll see, we took a number of amendments from the health occupations boards. We had a collaborative process over the last week or so with them and the governor's team. The board is now co-chaired by the members of the General Assembly who are on the board. We added a few other members from some of the smaller health occupations boards and clarified some of the language, and also clarified the dates for the first year of the commission. The bill is an emergency bill because we want the data to be posted as quickly as possible. We want the commission to start its work no later than July 1.
Obviously, there is a Senate crossfile.
No.
Or not.
No, this is the only
Okay.
bill. We've been working as a joint audit committee pretty late into the beginning of session. So, but we've been working collaboratively with our Senate, with my Senate co-chair and our Senate partners as well.
Fine. Very good. Is there any discussion on the bill?
Mr. Chair,
Yes.
just want to confirm with the sponsor that the reprint with these amendments are what we're looking at and that's the product you're satisfied with?
Yes, yes. Thank you, Madam Vice Chair.
Okay. Then I'd like to move the bill. I'd like to move the amendments, please.
The
Second,
amendments
is
are
this the
moved
one
and
out of
seconded.
319, right?
No, this is
1372.
1372.
The time
Yes, no, no, no,
is
no, I mean,
3:19 p.m. Yes,
Oh,
on
Yes,
3:17
yeah.
at the top.
Sorry.
Okay, sorry.
yes. So if that's the bill, then yes, I second that.
Okay.
Okay,
All
my
those in
hand-
favor of the amendments,
I'm sorry,
please
my
say
hand,
aye.
my
Mi-
hand is up for a question on the amendments.
I'm sorry, Delegate Riley.
It's okay.
Go
My
ahead.
head's getting confused with everybody else's here. Okay, so this bill, as you know, during the testimony, we had, and I believe the sponsor did a good job in saying he like worked with everybody. There was a lot of opposition. So all the opposition that I'm looking at, you're saying has been pretty much, everyone's pretty much satisfied with this now, with the product we have? Or is there
Delegate,
still any opposition at all left?
Delegate Riley, I can't say that everybody is satisfied with it,
Okay,
but we worked, we had a meeting with all of the health occupation, the smaller boards,
Right,
and their opposition was more about, they perceived them as being excluded. That was never meant to be the case. So
okay,
we took probably 80 or 90% of the recommendations that they had made, including adding 3 additional executive directors from the smaller board that's chosen by those boards to
okay,
serve on the commission. We clarified the timeline for this year, and they had some concerns at the way the bill was originally drafted, that the language was sort of too presumptive. I will just say again, this is a commission. We accepted a lot of their language tweaks, but again, at the end of the day, this is a commission to recommend to the General Assembly potential changes. It's not it is not a prescriptive bill in terms of changes. But
okay,
yes, I believe all of the boards that came in and testified are now satisfied with the changes that we've made.
okay, all right.
I would also add, this is the product of a legislative joint committee, and that's where it's important to hear from the boards, but this is one where the 2 co-leaders of the joint committee should be given great deference. But
Okay.
appreciate your questions,
All right.
Delegate Riley.
Thank you very much. Appreciate it.
Okay, so the motion is on the amendments, adopting the amendments as described by Delegate Solomon. All those in favor, say aye.
Aye.
Is anyone opposed to the amendments? Chair hearing none is unanimous. Is there a motion on the bill as amended?
Move the bill as amended.
So moved. Is there a second?
Second.
Second. Is there any debate on the bill as amended? Not all those in favor, please raise your electronic hand. The chair sees 6 votes in favor. Is there anyone opposed? Delegate Riley, are you opposed or are you favor? Your hand's still up. So are some others.
Sorry, yes, it should be up, yes.
Fine. It is
Thank you.
unanimous. The Health Occupations Criminal History Records Check, which is also the Joint Audit Committee, Delegate Solomon.
Thank you, Mr. Chair. This is a simple one. This just corrects and clarifies all of the background check requirements that were missing from the Health Occupation Board's statutes, again, directly out of the audit. This was a bill that was unanimously supported by the Joint Audit Committee, was actually worked on in collaboration with your committee and the boards and the governor's office. So appreciate, again, everybody's collaboration and work on this.
And this is joint with judiciary, so.
Correct.
Are we the lead or is judiciary the lead?
We are
I
the
believe
lead.
you are the lead. Yeah.
We're the lead. Okay. And there are no amendments?
Correct.
There are no amendments. Good drafting. Any questions of Delegate Solomon or of committee counsel? Chair seeing none, all those in favor of the bill, please raise your electronic hand. There are 6 votes in favor. Is anyone opposed? No one is opposed. I believe we are adjourned because we had 4 bills and they've all received favorable reports. Thank you very much. We are not meeting. We're meeting again tomorrow.
We are meeting again tomorrow. Yes.
But not before session.
No.
Okay,
That honor goes to health facilities and public health.
fine.